Welcome back. This is a time that I really enjoy because by this time you have probably listened to the other DVD, the 2 CDs, and we're now coming to an end here on this DVD, which has been dealing with self-esteem, effectively organizing your life. And now I just want to talk about positive words, about getting treatment for ADHD by taking really control here. You know, you've been through a lot. There's no question. Whether you've been diagnosed, whether you haven't been diagnosed, whether you know you have some of these traits, these conditions, call it what you will. And it's important to know that there are a lot of positive things too, okay? There are a lot of niche careers that are very interesting for people because you've got people, CEOs, executive officers, you've got pilots, you've got military. You have people that really like passion, that like fire, that like to do and try new things. Many of the most creative people around would be people that would have the ADHD. I think that's an important thing to remember. You know, there are people that believe when you look at someone like an Abraham Lincoln, okay? You know, you can look at a Winston Churchill. You can look at someone like a Bill Clinton. You can look at many people that seem to have a lot of energy or doing things, going forward, okay? May have some, you know, traits that are strange. I even look back when I look back historically at someone like Julius Caesar, talented in so many areas, great writer, great orator, top politician within the old Roman Republic, unparalleled military commander, had the energy to try to set up the empire, which lasted for 500 years after his death, did all kinds of things. Look at the energy level somebody had that would be going this direction, doing different things. The key is being able to control that creativity. Now there's the creativity. You know, if you can kind of go from point to point, you know, one of the negatives in ADHD is being in 2 or 3 different conversations, and maybe not even being in one at a time, and this ability to be one moment talking about the River Nile's fish population, and the next minute talking about nuclear physics, the next minute talking football, and the next minute maybe talking about clothes. Okay. This can be a great skill because you can also use this in creative experiences, because when you are hyper-focusing in a good way and you're really interested in something, you can go from point to point to point to point so quickly. Other people can't do that. It's a skill. So rather than being seen as joining 3 conversations, you're there thinking, you're starting off about, you want to promote something, you start thinking at one moment promoting it on TV, you're going to promote it, no, you're going to do it in writing, no, you're going to do it with emails, no, you're going to go door to door, no, you're going to hire someone. You just go on and on and on, whatever it might be, whatever it might be. And that becomes a great skill. And remember, once you have learned how to cope with your ADHD, whether through behavioral, whether through counseling, whether through the cognitive restructuring, the thinking, or through medication, you then can start doing things maybe you haven't been able to do. I remember talking to a student here, a graduate student here, who said, Dr. Braccio, I've read a book. I sat down and read a book. I said, really? So the medication has really helped. I said, the person said, the medication has helped, but I also told myself, I know I can do this. I know I can do this. And remember, whatever the condition, having faith in yourself is very, very important. And then people can start training they never could do before because they couldn't pay attention. They couldn't do it, but now they can. Now, by being able to focus, breathing in, breathing out, making better decisions, maybe having a support group, even could have an ADHD buddy, more sensitivity to people around them, are really able to do things. And imagine, you know, going to college, going for vocational training, whatever it might be, doing something, trying for a new job. And maybe personally, since I'm a happily married person, having a home where there's more peace, where you are much more able to pay attention, much more able to get the full message, much more ready to sit down in a more relaxed fashion. Yes, a better marriage, a marriage that was maybe faltering, maybe relationships that were always bad. But all of a sudden, things are going better. And as a parent, more tolerant, more understanding, more tuned into the needs. Isn't it wonderful when you really think about it? Being a much better parent and knowing where things are. Not have to look for your cell phone, not have to look for your keys. No, not doing that. Or what about knowing financially where you are, not saying, golly, where did I put that phone bill? Where did I put that heating bill? Knowing they're all in one place. All in one place. And you did it. And the creativity. You now can even channel the creativity more because you can now focus more different times. The fact you can sleep better, even have better sleep patterns. Because now when you're tired, you're able to relax. The mind is not going, 100, different ways. And you're able to have deeper relationships with people because you can now spend time talking and understanding. It isn't like you talk for a while. No, you can be more involved. And at work. What about work? This is another place you're doing much, much better. Work. You're able to focus. You're able to do things. This is very important. Yes. Very, very important. Taking control. Now, my feeling is I really want you to be proud of yourself because you're trying to take control. You're doing better. But through treatment, through a combination of medication, counseling, using some of the behavioral, meaning if you do such and such, such will occur, planning, okay, I will do this, then I will get this for it, give yourself rewards, cognitive restructuring, rethinking, these types of things. If you can do that, you're doing it. You're going to feel better, you're going to be more successful in life, you'll do better at work, you're going to do better in a marriage or a relationship, you're going to do better in friendships, you're going to do better around the home, you're going to just have a really positive time. You're going to be, believe it or not, like an average person, like a person who doesn't have all this impulsivity, all this inattention, all this hyperkinetic, call it what you will. But remember this, once you can tame the impulsivity, hyperactivity, the inattention, and take control, what you're doing, you can then have a normal life and a good life, good relationships, good work situation, better sleep patterns. You can have a well-organized life. You can have a whole bunch of things, and you can do that. And you're going to do it. And that's why I've left this kind of to the end here, a positive set of statements. You can do it. You can be happy. You can go out with a smile when you go out with your spouse or a friend. You don't have to worry about everything. Did I do this? I'm doing 100 different things. None of that. Taking control. So, good luck. I'm glad you've taken part in this experience, and I hope you're going to go over and use these materials over and over again, because I think they can really be helpful to you. I'm glad that I've had a chance to be a guide in trying to help you take control. So, from Dr. John Braccio, I wish the best to you, and if you have any comments, any suggestions, anything, please do contact me at braccophd.com. That's BRACCIOPHD.com. Best of luck for a wonderful life.